patient's being treated for an acutely injured lateral ankle sprain resulting in pain and swelling. Demonstrate ability to apply an ice bag to the right ankle of the patient. Begin with informed consent. Explain your steps. Follow up as needed.
All right. So, so again, I'm Chris. We're looking at your ankle. Your doctor sends imaging. Doesn't look like there's anything broken, but you have a bunch of swelling in your lateral ankle. So it's assumed that there's going to be a sprain there, and there's going to be a bunch of damage to the tissue, which will cause the swelling to occur. My primary treatment, since this is an acute injury, within the past 2 days would be an ice bag, crushed ice bag, just so we could get the whole area covered in ice, and that will reduce the swelling as well as reduce the pain that you're feeling from your ankle. The only problem is that could cause burns there if you have a low tolerance as well. That's dependent on how you're feeling with that. Alternatives to that would be you could immerse your lower leg in lower half of your lower leg in an ice bath or an ice tub. I don't think that's necessary considering it's just your ankle that's being affected, and the ice bag will target that area as a whole. And the other option would be an ice massage, which would be very pinpoint, but it will not be cover as big of an area as the ice bag would. So it depends on kind of what you're feeling. I recommend the ice bag, but it's ultimately up to you.
Ice bag.
Ice bag? Alright, cool. So I'm going to have to remove your sock. Okay. First, I'm going to take a pulse just to make sure that nothing's being affected there, just so after I can assess the ice bag and make sure nothing got affected. So he has a pulse. Cool. So I'm going to have him lay in a position of comfort right now. This allows me to access the lateral ankle the best when I apply the ice bag. Okay, so now I'm going to go and fill the ice bag from the bag to the person's body part that you're attaching to. What you're going to do is you're going to tie it off at the top.
Okay.
So I'm just making sure that her skin is clean, kind of
Yeah.
on anything.
Kind of form it to the ankle, covering the majority of the distal parts of the leg, which could also be affected, as well as the proximal parts of the foot of the ankle. You're going to be doing this. There's 4 stages of cooling, so first you're going to feel a cold sensation, followed by a burning sensation, which is perfectly normal, then an aching sensation, and then numbness is what we're trying to reach. Because when it starts to get numb, that's numbed, it's constricted all the blood vessels in there, which is going to start preventing further swelling from occurring, as well as it's going to dull the pain in your ankle, which is where our ultimate goal is here. And I reassess every 5 minutes, and then I check for his pulse again to make sure that the ice isn't directly affecting his main circulatory system too much. And then I'd also be asking the patient about every 5 minutes how he's feeling, if it's burning or not. You don't need to put a towel between the person for a crushed ice bag, but you do need for a chemical one. So if I was using a chemical one, I'd want to put a towel there. But it's also patient preference. So if this is too strong for him, I could also put a towel as well. So I put this on. I'd say. What?
Sorry, go for it.
I was gonna say probably for like 10 minutes.
Okay. What's in your right hand?
Oh yeah, and this is the wrap. So then instead of me just standing here and holding it, I could wrap it. Yeah.
Tell me what you're changing,
Alright, so
Yeah, you don't have to.
no, okay,
I'm cold.
Oh, yeah.
okay, yeah.
All right.
Good
You
point.
wanna-
Sorry.
Solid point.
What are some of the benefits of using the wrap?
So the wrap, it compresses it as well, tightly to the ankle.
Good.
And then after treatment, I'd be assessing the skin again, as I did for the e-stim, for any burns, especially discoloration. It should be a little red just because it's irritated, but it should be like black or a pasty white, because that's not good.
Good.
So.
So you want continuous though?
Yeah.
Good.
All right.
So